Dr. Priyanka Saokar. I am owner of Deccan Dental Clinic, which is located in Pune on FC Road. So today I am continuing the orofacial trauma topic, which is the part 2 now. Part 1 we have already covered what is orofacial trauma, what are common causes for it, and what are the sign symptoms for it. This topic will be covering how to diagnose orofacial trauma, and second, how to treat it. First, how to diagnose it. It starts from the chief complaint. What is the chief complaint of patient? Second, what is the history of patient, how it has occurred, whether patient has a sudden blow on face or sudden fall, what is the history. Along with that, we need to ask patient medical history also. Third, we have to ask the patient signs and symptoms related to it, whether there is blurring of speech or slurring of speech or difficulty in breathing. All those points we need to ask them, what was there prior to the trauma and what happened after to the trauma, everything in detail, just to rule out what possibilities are there, whether it is related to only the soft tissue injury or the hard tissue injury or some neural injuries. So we have to write down all those things in detail so that we need to plan the treatment accordingly. So we have to rule out those things. After that, we have to advise them few X-rays, like for the dental checkup and the dental diagnosis. Usually we advise OPG, lateral cephalogram, and frontal cephalogram. OPG just to rule out whether there are any fractures in the tooth structure, or whether the injury has caused avulsion, or just to rule out what is overall status or the bone fractures are there or not. Then we advise lateral cephalogram just to rule out whether there is any type of zygomatic fractures or other fractures. Along with that, we ask the frontal cephalogram to rule out the skull, zygomatic bone, maxilla, mandible fracture, whether any fracture lines are seen in those X-rays. Along with that, we advise CBCT just to get the clear picture, 3D dimension picture of all the problems what patient is going through, and whether there are fractures or any abnormal pathology is seen in orofacial structure. Once we rule out that, once we diagnose the problem, then next comes the treatment part. It will be according to the patient signs and symptom. If patient has difficulty in breathing, we need to rule out the nasal problem, and so that patient can breathe properly. Difficulty in speech, we have to rule out the oral issues and treat it accordingly. If the patient has dental issues, fracture tooth, then we have to restore it. If the fracture is too deep, then we have to do the root canal treatment along with the crown. If the patient has avulsion of tooth, then we have to reimplant the tooth if possible. If the patient comes within a span of 1 hour, then we can plan accordingly. So all these steps we are supposed to take. If there is a soft tissue injury, then we have to do the multi-layer cosmetic procedure to stitch that tissue and to control the bleeding. If the patient has hard tissue injury, then we have to fix with the plates or the screws if these are needed, so that the mobility of the jaw structure and bone structure will be less and the healing will be faster. So it will be treated according to severity of the level and severity of the tissue involved. So this is all about how to diagnose the orofacial trauma and how to treat it. So do like my channel, guys. Bye bye, take care.